This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Magneon Injection is an essential treatment for magnesium deficiency. It is particularly beneficial for pregnant women facing severe complications. This medication is administered under medical supervision. Indications and uses. This injection is utilized to manage magnesium deficiency in the body and to prevent and control seizure outbreaks in pregnant women suffering from severe pre-eclampsia or eclampsia. Additionally, it aids in restoring magnesium levels in patients receiving total parenteral nutrition, ensuring healthy nerve, muscle, and bone function. How it works. Magneon works as a mineral supplement, providing the body with sufficient magnesium levels necessary for maintaining healthy nerves, bones, and muscles, while also regulating heartbeat and energy levels. Directions for use. Magneon will be administered only by a qualified doctor or nurse, either through an intravenous infusion or an intramuscular injection. The healthcare professional will determine the appropriate dosage, duration of therapy, and frequency of administration based on the patient's age, body weight, and specific medical condition. Possible side effects. Common side effects include pain and swelling at the injection site, facial flushing, nausea, vomiting, muscle weakness, and drowsiness. It's crucial to monitor these effects and consult a healthcare provider if they worsen. Precautions and warnings. Prior to administration, it's essential to inform the healthcare provider of any existing liver, kidney, or heart problems. Additionally, caution is advised if there are concerns about low calcium levels or muscle weakness. Pregnant and breastfeeding women should only use this treatment if deemed necessary by a physician. FAQs. 1. How does Magneon work? It supplements the body with magnesium essential for nerve, muscle, and bone health. 2. Can it cause hair loss? Yes, in some cases, it may alter normal hair growth patterns. 3. How long should it be taken? This is determined by a healthcare provider based on individual needs. 4. What if a dose is missed? Consult your doctor for advice. 5. Is it safe? Yes, when used under medical supervision. Thank you for watching. If you have any questions or suggestions, please leave them in the comments below. Your feedback is valuable to us.